Hi, good evening. Austin Mayor Steve Adler. You got a minute? We're going to go over quickly the dashboards tonight. You can see how we're progressing. Talk about Dr. Escott taking us down to risk level 3. Talk about prospects of getting to risk level 2 if we continue to wear our masks. A couple other things we'll touch on, but mostly the numbers. Tomorrow, we don't have a joint meeting with the county, but I expect Dr. Escott to give us and Director Hayden to give us some information, numbers by memo, and I'll go ahead and report those to you tomorrow. But for today, let's take a look at the dashboards that we look at so that we can see the numbers. The first dashboard we're going to take a look at are the key indicators. And you've seen this one, obviously. We always look at new admissions first. You can see the number is 16. That number continues to go down. That takes our 7-day moving average down to 20. Yesterday, it was at 22. We had 18 admissions yesterday. Going down to 16 takes the 7-day moving average down to 20. This Saturday, Dr. Escott recommended and took us down to stage 3, which is in the yellow area here. That's generally speaking in the area of 10 to 30 for 7-day moving average. It's not absolute. Before we move risk levels, Dr. Escott takes into account more than just that number, but that's the key indicator. You can see we're at 20 right now, which is halfway through the yellow area, actually at 19.9. If we continue on through, then maybe we can get down to the blue area. Right now, vaccines are helping us get there. So are the behaviors that people are exhibiting, including maskings. Number of new cases today, 184. That's a concern. The 7-day moving average is 132. Remember, as we start heading into spring break, as people start relaxing, as people start gathering in more and more groups, this virus is not over. If you recall, the last surge we saw in December began with an increase in the number of new cases. So we have to continue to watch that. If the demographics are as we've been reporting, the number of new cases will be disproportionately younger people, because the older people are getting vaccinated, which means that those number of new cases might not translate into new admissions, or at least the same level it was happening before. But we'll continue to watch that. It's the positivity number we want to continue to go down. We're 4.6 last week. And tomorrow, hopefully, we'll get a new positivity number, and I think that that number will be heading down. So let's stop with that. Let's go to the next graph, our chart dashboard that we take a look at. This is the Austin Travis County one. Talks to us about hospitalizations and the like. You can see that the census in our hospitals tonight are the 182. The 7-day moving average is 197, so we're below that. ICU 61, which is below the 67 7-day moving average. Ventilators at 40, one below the 7-day moving average. These are great numbers. We were up, we were up multiple of this. ICUs, you recall, we nearly got over to 200. That's when we were alarmed, and the number's been coming down since. Number of people that have passed away, 780. That's one more than yesterday. Hopefully that'll start slowing down. By virtue of the practices that we've had in Austin, Austin Travis County has one of the lowest mortality rates among metropolitan areas like this, among cities in the country. We should be proud of our local effort for that. If we have 1.3 million people in Austin and Travis County, that's about 60 deaths per 100,000 people. I think what the national average is like 150 or something like that. So that's something that together, collectively, we should be proud of. Let's take a quick look at the University of Texas modeling, just so that we can see what it is that's being predicted at this point. Let me see if I can find that here. Here's the University of Texas dashboard. You can see the R factor is below 1, which is where you want it to be. In fact, it's at 0.66 right now. If we were able to maintain the same kind of behaviors we've been maintaining, and this is good as of March 10th, so toward the end of last week. So the numbers are a little bit older, 5 days old for us at this point. But you can see it comes down, it's continuing down, flattening out just a little bit. But you can see here as we head into April, we get to a place where we get to here, maybe by the end of March, we get to a place where we're below 10, and then 7 more days trying to stay below 10. It might be just a month from now, 3 weeks from now, if we were able to maintain where we are, that we would actually go from the yellow number range to the blue number range, which would increase even farther the number of people that we can be around, the groups we were in. Positivity would go down that much more. We can wear masks while we have kids more and more going back to school, and we can wear masks while we open up more and more businesses. This is kind of the measured approach to opening up an economy that seems to make the most sense. But those are hopefully the numbers that we'll be striving to get to. Hospitalizations in the area following the same kind of numbers and averages. ICU patients, how close we got to 200 back in mid-January. Now back down to a place that just obviously makes a lot more sense and is helpful for all of us. So let's keep up that work. You will recall that the our mask mandate here locally, challenged by the Attorney General. The judge last Friday said that she wasn't going to end the local mask mandate pending a hearing on March 26th. That means the mandate's in place as we go through spring break this week. And I like having that communication message that we still need to be doing that as we go through this period of time, which presents, risk while we continue to get people vaccinated. Last week, Dr. Escott and Director Hayden had said that we would be giving at Austin Public Health vaccines to people in the 1C group. Those are people age 50 and above. They're eligible now by the state rule. But Austin Public Health tonight, when it's giving out vaccines, will not be giving to that 1C group because we just don't have the supply. We didn't get as much supply in the county, in the area, as we have in past weeks. It's been down a little bit. Austin Public Health still got their same 12,000, but because of that, they're going to continue to focus vaccines this week on 1A and 1B. Those are people 65 and older, or less than 65 if you have a comorbidity, but essential healthcare workers and the like. New website, new platform. I hope those folks that are going on will see a system that is getting better and easier to use. But as we get those vaccines to more and more people, there's kind of light at the end of the tunnel. I continue to believe that in May, everybody who wants a vaccine will have had a chance to get one. We can move to greater normalcy this summer. But for now, that means we have to keep wearing masks. So hashtag mask up ATX, mask up ATX. you want to go on to that site and leave us a comment as to why you're masking, that would be great. Excited that the city of Austin has announced the emergency rental assistance program. We have another, I think, $26 million from the federal government issued in December that we're now employing to help both tenants and landlords with cash flow. This is the relief emergency needs for tenants, the rent program. Provides rent assistance for Austin residents who earn a low income and have been impacted by COVID-19. The application portal opened today. It can cover rent for 15 months in its entirety. I think it can go back 12 months in order to be able to help. That should help some tenants be able to avoid evictions when evictions are again allowed, and it'll also help landlords get some income stream, because I know landlords have also been hurting when tenants can't pay rent. This rental assistance program now a little different than the one we had before, in that landlords can also apply. My understanding is that in the first 2 hours that this portal was open today, there were 500 applications. So there is the portal, austintexas.gov/rent. This is the rent program. I urge everybody to take a look at this. It opened today, and it'll stay open until all of the funds are spent. So if you're in a low income, been impacted by COVID-19, or you're a landlord with a tenant with a low income impacted by COVID-19, the virus, please make sure that you take advantage of this program. Also want to point out to you that South by Southwest Online starts tomorrow, goes through Saturday, March 16th. Goes through Saturday. This year has a number of exciting panelists, including the owner of Austin FC, the new soccer team, performance from musicians from all over the globe, piped directly into your homes and offices, an amazing selection of films highlighting a number of social issues, many of them including homelessness. You can find the panel on homelessness that I'll be participating in. A lot of people really remember at this point, about a year ago, that because of COVID, we canceled South by Southwest. I really appreciate the cooperation of the South by folks at that time. Horrible deal for them. It hurt so many people, but this virus was spreading. We had tens of thousands of people coming into Austin, planned to come in from Austin, many from areas that were dealing with COVID outbreaks. Like we had 5,000 people coming from Seattle. It would have really set us back. But you can participate in it this year virtually. There's the site, www.southbysouthwest.com, so that you can register. It's a great program. I urge everybody to do that. And I'll tell you that I am waiting for next year when we can have a return. Those are the numbers. You all take care and be safe. And good night.